Welcome back to Alive and Well Community's Daily Dose, your daily dose of support. Now, during this time of COVID-19, we've been getting a lot of questions about how is it that we take care of our health care? When is it that we should be seeking health care amidst the pandemic going on? And to help us in answering these questions, we've got two phenomenal guests with us today. We've got Dr. Melissa Tepe, who is the Chief Medical Officer for Affinia Healthcare, a local federally qualified health center, as well as Angela Brown, who's the CEO of the St. Louis Regional Health Commission, an organization that's charged with helping to protect the safety net, the health safety net, here in the greater St. Louis region. So thank you both for joining us today as we have this really important conversation. And during a time when there are just a whole lot of questions around healthcare right now. So thank you to you both for joining us. So I wanted to just start, Angie, if you would, could you tell us a little bit about the St. Louis Regional Health Commission, as well as the Gateway to Better Health program?
Of course. Good morning, everyone. As Sean mentioned, I work for an organization called the St. Louis Regional Health Commission, and we are a nonprofit organization that works to ensure those who are uninsured and underinsured have access to health care. Our board is made up of the healthcare leaders in St. Louis City and County, so your major hospitals, as well as your community health centers, along with representation from our mayor, county executive, and our governor's office. And we do work to coordinate it to ensure that we have a safety net system that is able to support our uninsured and underinsured individuals. Through this, we have a program called Gateway to Better Health. It is a coverage program very similar to what you would think of insurance for those who are uninsured in St. Louis City and County between the ages of 19 and 64. This program was meant to be a bridge till we had a more sustainable option for healthcare, which was Medicaid expansion. But as many of you know, Medicaid was not expanded in our region. So what was meant to be an 18-month program, we have now had for about 8 years. And we are currently expected to expire in December of 2022. So hopefully we are following Healthcare for Missouri with their efforts to expand Medicaid in our region. So hopefully you're following that. And if it does make the ballot, that you go out and vote in November. But what Gateway does in the meantime is to try to provide support, a bridge for those who do need under 100% of the federal poverty level, which is about, I think, 12 or 13,000 for an individual. And for a family, it's between 22,000, 24,000. And so that's a family of 4. And so if you do meet those criteria and you go to one of our community health centers, which would be any of our federally qualified health centers, like Dr. Tepe's Affinia Healthcare, her organization, along with Family Care Health Centers, Betadine Care People's Health Center, CARES TL, and also the county public health departments have clinics throughout the county that you're able to select as a primary care provider. And so Gateway will cover your primary care services that you receive there. If they have services like specialty care, so if you have to see a heart doctor, cardiologist, or another kind of specialty doctor, Gateway will cover a referral to one of the medical schools, WashU or SLU, or any type of testing you may need from our hospitals or surgeries, as long as they're outpatient. We also provide transportation for 2 appointments, and we cover generic prescriptions. And because we have a high proportion of chronic disease and there were not generics for insulin inhalers, we do provide brand name insulin inhalers. And last year we added a benefit for substance use. So if anyone is having any issues with substance use, all of our providers, primary care providers, have staff trained to offer that level of assistance to you. And so that is essentially the Gateway program. If you are interested in applying, you can go out to our website. I know Sean had just had a banner with that. There is an application there where it's a fillable PDF, so you can actually complete it on your computer and probably even on your phone. And you can email it to to your health center. You can email it to gbhissues@stlrhc.org, and I'll put that in the comments. or you can fax it to our offices. And again, I'll type that information in the comments for you. Or you can just mail it to your health center if you're interested in applying for the program. And if you don't have a printer where you can print it, you can definitely take a picture and email it from your phone.
Wonderful. Thank you. I know, Dr. Tepe, that people have a lot of questions about, if I'm not feeling well, do I just stay home? Do I just try to treat it myself? Or when is it that I should reach out to a doctor if I'm feeling symptoms that may not be coronavirus related?
Mhm. Great question. And I know there's a lot of uncertainty out there about coronavirus, about when to come to the doctor versus when to go to, say, an urgent care or the emergency room. To complicate factors, it is allergy season here in St. Louis. So some sneezing and coughing with kind of both eyes being a little watery and itchy nose is very common during this time. But just so you know, I do work at Affinia Healthcare, and we are a community health center. Greatly appreciate Alive and Well and the Regional Health Commission. And while I work for Affinia Healthcare, and some of these things will be specific to that, our colleagues in the community health center world, so as Angela said, Family Care and Peoples and Care STL, all have had similar changes and similar offerings. So while I can't speak for them, in general, many things are probably similar. So I do think if you are feeling symptoms, if you're feeling, body aches or feverish, but it's not really a fever or a new cough, the best thing to do is still to reach out to your primary care provider or your community health center. Now, I would do that by phone. So the safest thing for everyone, for the patients, for your family, for however you're getting your transportation, for the health center, is to first kind of have an evaluation over the phone. So if
Mhm.
you call our general appointment line number, which is 314-814-8700, what they'll do is they can either put you in touch with a nurse for triage or get you an appointment with your doctor or nurse practitioner or physician assistant. And that first visit will be a telehealth visit, will be over the telephone. And that can really give us a better sense of, do you need a face-to-face visit? Is it just reassurance that's needed and some over-the-counter medications that make you a little bit more comfortable? Is it COVID testing that's needed and you should take more coronavirus precautions like self-isolating at home? And so that telephone visit is really, really important. We're also piloting some video options as well, but the telehealth visits are going really well. I think both the providers and the patients are appreciating that touch, even if it is slightly different than the way we're used to performing medical care. But again, reach out, call us over the phone. We can definitely help you out with a telehealth visit or a nurse triage that's over the phone to better guide you.
Now, we know that some in our community during this time may not have a primary care provider. So, if we're feeling sick or if we're needing medical attention, but it's not an urgent need, it's something that we can see and work with a primary care physician. What is the best thing for us to do right now?
Yeah, so I think the best thing to do would be to call in first.
Hmm.
If there's a nurse available to help triage over the phone, that's helpful. Otherwise, like Affinia Healthcare does have an urgent care at our 2220 Lemp location. And that's open Monday through Friday. So if you are feeling like you need to see the doctor, that is a place where you could walk in without being an established patient. New patients with chronic conditions that need more medication management that would be new to us. You can call in, but we're kind of taking as a case-by-case basis at this time. Once the stay-at-home orders are lifted and we have more direction on reopening business as usual, then we will transition those patients back into the schedule. So I think urgent care is a good option for that. Now, also keep in mind, anytime you either call us on the phone or come into one of our locations for any type of service, we are going to screen for COVID at the entrance. So we're going to ask you about fever or cough or shortness of breath. And with that, we will make sure our employees take appropriate precautions, as do the patients as well, but we'll still be able to take care of you. I also want to mention the COVID screening number that we have. So for Affinia Healthcare, we have, as of tomorrow, we'll have 5 COVID screening locations. They are open. They are appointment only. So you must call the number first to be screened. We are going by CDC criteria. So in general, most members of the community will need either a fever or a cough or a shortness of breath to be screened. And the number is 314-833-2777.
And if we're feeling symptoms of COVID, do we need to have a primary care provider already in place?
No, you do not. So if you are concerned for COVID, please stick with all of the general hygiene principles recommended by the CDC: frequent hand washing, don't touch your face, cough etiquette, social distancing, wearing a mask when you're in public. But if you call our Affinia hotline, we're going to screen you. We're going to get you an appointment to be tested based on those CDC criteria, those symptoms that I just mentioned. It is of no direct cost to the patient, and you do not need to be an Affinia Healthcare patient to be tested. This is a community service that we are offering to ensure that we can care for the general community around us, and not just our own patients.
Wonderful. No, so again, I just want to highlight that point that if you don't have insurance and you aren't already previously established patient, that you can go and get tested then.
Correct. This is open to the general public. And again, there's no direct cost to the patient. We do ask for insurance information or a Medicaid card, and the lab might charge, say, your insurance company, but we're not collecting any fees from the public. If you are uninsured, we're not asking you for any money. We simply want to help take care of you, get you tested, so that we can give you the best medical advice to keep you and your family and your loved ones safe.
No, that's wonderful news. Now, I know.
Nope.
I think he may have froze.
Can you hear me, Angela?
I can hear
Okay.
you.
Can you hear me, Angela?
Yes. Can you hear me?
Okay. As Sean gets his video, yeah, I can hear you. As Sean gets his video maybe up and running, I can't hear him. He seems to be frozen. I
think
can
so.
also go over our testing sites. So as of tomorrow, we will have 5 throughout St. Louis City and County. So in the city, here at our 1717 Biddle location, and also opening today at 4414 North Florissant, which is on North Grand as you get to the water tower. In the North County, we have our Page location at 6763 Page, and our newest location that opened yesterday in Jennings at 8960 Jennings Station Road, which is adjacent to the Urban League location, and we thank them for their partnership. And tomorrow we open a South City location at our 3930 South Broadway location. So really trying to have sites that are throughout the city and the county, especially those hardest hit in North City and North County, and adding the South City site as well, given the data that we see on the city website. And again, that's by appointment. So call the number 314-833-2777 to go over those screening questions with a nurse, and then your appointment for testing. Welcome back, Sean.
And Dr. Tepe, I just want to add one point. When you mentioned urgent care, one of the things that Gateway also does cover is urgent care services.
Yeah.
So if you are a member of Affinia Healthcare and have Gateway, that will be a service that will be covered under Gateway.
No, we did have a
I do. Oh, go ahead, Sean.
we did have a few questions that came in, and I'm sorry for the technical difficulties that we're having here. One of the questions we had is if we're experiencing any symptoms that may align with COVID, when is it that we should reach out and ask questions about, is testing appropriate? Do we wait
I
till?
would reach out earlier. Yep. I would reach out earlier rather than later. The symptoms that are really listed as the top 3 symptoms that most people experience when they are ill with COVID are fever, cough, or shortness of breath. Other symptoms to be aware of that many people experience, especially perhaps at the beginning or with mild illness, would be generalized body aches, as well as loss of taste and loss of smell. So if you notice those things, I would also call in either to our COVID hotline, or if you have a PCP, to kind of have a telephone visit with your primary care clinician. That way you can kind of be tracking those symptoms to know when it's appropriate to get tested. And as always, if you have any inklings or notions that you might be developing some symptoms, try to take those precautions of hand washing and social distancing to help prevent any spread of any illness that you might have.
Wonderful. And then, Angie, I wanted to also reach out with another question to you. And we know that right now, as we're watching our budgets and as some people in our community are experiencing some financial hardship during this time, including higher rates of unemployment, one of the things that we often let go first is our health care and even taking care of our physical health. Now, we know that there are options like the Gateway program. When is it someone should consider applying if they're experiencing financial hardship, but they need to have that health insurance?
Sorry, my mic was muted. Definitely as early as possible. If you lost your health insurance, lost your job, please reach out and apply for Gateway as soon as possible. Just because even if you're not sick now, as long as you have some type of insurance when you do have symptoms or are sick, that you'll have something in place to help cover you. Also, if for those of you who have lost their jobs, that is a major life change. So you can, it makes it open for you to apply for the marketplace because we are a state that doesn't have its own exchange product or marketplace. We use the federal system. It's not opened here, but any type of changes you have, life changes like the loss of a job, would make you eligible to be able to apply. So definitely explore those options. And again, I think one of the things that we're seeing here is why so many of our underserved populations have been hit hard with COVID-19 is the fact that we don't have a health insurance option for everyone. And so definitely another plug for Medicaid expansion. From the Regional Health Commission, we have been advocating for our government to go ahead and expand Medicaid now because it would definitely help so many individuals who are uninsured and those who have experienced many of those life-changing situations that have left them without health insurance. So definitely, hopefully, Healthcare Missouri, they're collecting signatures to put this on the ballot for November. But anytime that we can have coverage for those who need it the most, having healthcare does put you in a different position to be able to access care earlier. One of the major issues that we've heard from our patients is that they have been delaying care because they think it's a cost. They also feel like they don't have transportation to get there and don't know options to have those things covered. So I love Dr. Tepe mentioned that this is a free service. So definitely if you are experiencing symptoms, do not delay. Go out as soon as possible because we don't want it to get worse and then you're left home or you end up in the worst condition because you delayed that care. Again, these are free services. And if you need help with transportation, please feel free to reach out. You can contact the Regional Health Commission. We definitely have options to assist with that.
Wonderful. And I know as we talk about healthcare and as we talk about providing Missourians with greater healthcare, one of the most important things that every single Missourian needs to do during this time is definitely the census.
Mhm.
I know it seems like the census 2020, that seems like a low priority during this time, but we know how crucial the census is for even bringing in dollars to help support
Mhm.
healthcare. Angie, is there anything that you can highlight for us around the importance of the census that we need to know about?
Definitely. I'm glad you mentioned that. I completed my form. So definitely if you receive something in the mail, it says resident, but please fill those out. That is definitely important. For every person that we miss, we lose representation in our area. So a few years ago, we did lose a Congress position. And so when you lose population, it impacts a lot of things. You lose money. I forget the number, but definitely we lose money and other resources when we don't have everyone counted. And so we do want to ensure that everyone is counted, everyone in your household is counted. Definitely, this is not information to track you, or the government is not trying to harm you in any way. We just want to make sure that you are counted, so that we can get all of the dollars that we need from Missouri so that we can provide those care and have places like Affinia Healthcare around to provide care for those who need it most.
Absolutely. I know sometimes we may think that something like the census is a low priority during this time.
Mhm.
And we know that there are major concerns and big priorities, but recognizing how the census needs to be part of that equation so we
Mhm.
have those dollars coming in for every single Missourian to provide those crucial services.
Right.
So wonderful. I just want to say a big thank you, but before I let you two get back to your incredibly busy days, is there anything else that we should know about whether it's accessing healthcare during this time or whether it's about things like getting healthcare?
If I might, Sean, just to stress again that don't put off healthcare, especially if you're feeling symptoms or have chronic medical conditions like diabetes, high blood pressure, heart disease, because we know that folks with those chronic conditions are also at risk for COVID and getting sicker with COVID. So we still want those conditions treated. Just to reach out over the phone first. We are trying to do so many things over phone or video to better keep everyone safe and healthy at home, but that doesn't mean that care stops. I also want to mention that our behavioral health team, this is a time of great uncertainty and a time where we need to pull together and support each other as best that we can. Our behavioral health team has pivoted to many telephone visits, and so that is still possible. Substance abuse also did not go away. In fact, many folks are more stressed now than ever, given life-changing situations and the
Mhm.
uncertainty of COVID. Our substance abuse teams have also pivoted to doing mostly telephone visits. Same thing with our medication-assisted treatment program for opioid use disorder. Those things are still happening. Just reach out over the phone, as most of them are happening telephonically or with video. Um, Same thing, pharmacy, our homeless program, WIC, all still happening. Even dental care still happening on an urgent or emergent basis. Again, call
Mhm.
first. But our dental urgent care is open at our 1500 Park location. Preventative dental care is not happening due to the American Dental Society recommendations, which are appropriate during COVID to keep everyone safe. But if you have an urgent dental need, they're open. They will screen you verbally for COVID to ensure it's safe for you, other patients in the team. But that care is also still happening.
No, I think that's important information that even during this time of a medical crisis going on, that we should not neglect our own healthcare during this time. That in that neglecting of our healthcare could make us even more vulnerable to things like COVID-19. So I think that's crucial for all of us to remember that our health is still very important during this time. Angie, is there anything else that we would like to share or that you'd like to share with our viewers who are tuning in as we think about accessing healthcare?
Yeah, I just want to highlight and thank Dr. Tepe and all of our community health centers. So if you are in need of care and you're like, Affinia is not in my area, there are definitely other community health centers that you can reach out to that has very similar services to what Dr. Tepe has um, described here. So please feel free to reach out. And also wanted to acknowledge that prior to April, we didn't have testing available in North City, and do want to thank Affinia for taking the lead, and they stepped out to be the first testing site that was available in North St. Louis. And since then, they've added now up to 4 sites, as well as CARES TL has 2 sites available, and People's just opened the site in North County last Friday. So now we do have testing in North City and North County. So there are testing sites available, and hopefully that reduces a lot of the barriers that we've seen for people getting testing and treatment for COVID-19. So definitely, please, as Dr. Tepe mentioned, if you are feeling ill, you have a family member that's feeling ill, please get them connected as soon as possible.
Thank you both for all of this wonderful information. And I just also want to say a very personal thank you. Like one of our viewers mentioned, we know that you all are providing essential services during this time to keep our community alive and well. And so with a big thank you from Alive and Well Communities, from our viewers, from our region. Thank you for all you're doing to maintain the health and well-being of our community, to ensure that people have access to services and have access to services despite ability to pay. So for those of you who are tuning in, make sure that you share this daily dose with someone who may need that daily dose of support, recognizing that our healthcare is important even during this time, and probably even more so during this time. And so make sure that if you or someone you know is needing those healthcare services, make sure that you're sharing this vital information with them. And again, Angela and Melissa, thank you so much for the crucial work you're doing. And also thank you for taking time out of your busy schedules right now to be with us and share this very important message. Well, thank you so much. And to our viewers, we hope to see you back here tomorrow for another episode of The Daily Dose.
Thank
Take
you.
care.
Thank you.